Good morning, my dear brothers. Welcome to our class, Biomedical Ethics. Yesterday we dealt with artificial insemination and artificial fertilization. Today we shall learn something about IVF. What is IVF? Full form of IVF? In vitro fertilization. You know, couples today here in India and around the world may seek in vitro fertilization when they are infertile or having difficulties in getting pregnant. Sometimes the woman does not ovulate regularly, which reduces or diminishes the chances of conception. So women usually produce one egg each of the month. But with in vitro fertilization, the woman's ovaries are hyper-stimulated by drugs to produce more eggs at a time. So it is against the natural way of bringing egg from the ovaries. By natural cycle, the woman is allowed, or woman, she has the egg one every month, but overdose and hyper stimulation by the drugs, we are forcing against the body, against the natural cycle to produce more eggs. That is taking place in vitro fertilization. The eggs are extracted, or we say removed, by the surgical procedure by the physician. Suitable ones, or so-called the good ones, are fertilized by the husband's sperm in the petri dish, in a petri dish that is called in vitro. In vitro means a glass dish or petri dish, and others are simply discarded. Okay, so the physician who takes the egg from the woman and sperms from the husband, the man, and he does the joining them, putting them together in a small dish, small plate, and the physician decides which sperm to be put along with the egg, and other sperms he can simply reject or discard it. He can simply throw it in the dustbin. But the sperms, they have, each one has got their life. The millions of sperms when they are passing, during the relationship, when the sperms are released, millions. They are not one or two. They are millions in number. So the physician in the lab decides, which sperm to be taken and which egg to be taken and whom to give life. And the rest, either they are frozen, kept in the deep freezer, or they are simply discarded, thrown away. But they have life. This is what taking place in vitro fertilization. Now let us see a simple definition of IVF. In vitro fertilization, that is IVF, is the process of joining a woman's egg, the ovum, and the husband's sperm in a lab rather than inside a woman's body. The whole thing is taking place outside human body. It is taking place in the lab. The Latin phrase in vitro means in glass. It's a glass piece, in a dish, where we keep our side dish, or where we keep our, glass in a small saucer, It's taking place in a small glass piece. When the egg is fertilized by the sperm, the result is a living embryo, which is then implanted, placed in the uterus of the woman's womb, so that it can develop like any other baby. So the whole thing, the life takes place not inside the woman's body, but rather in a lab, in a petri dish, in a glass. Now who decides the life here? Not the husband or wife. The physician, the technician decides the life, which or which sperm, which egg to be chosen, and the others, he can just close his eyes and throw it away. We don't know whatever usually they throw it, or they keep it in the freezer, deep freezer. They are frozen. They can be reused for after a few months or a few years, depends. depends on the capacity and strength and what you call of the sperm and egg. Usually they are thrown, usually they are disregarded, rejected. Okay, this is a simple definition. I shall give in the notes when I give. I shall give 2-3 definitions, and you have the more clarity. Now we shall see a small video clip. How the IVF is taking place. Okay.
In vitro fertilization is a process where a woman's eggs are fertilized outside her body, then placed back inside her body to help her get pregnant. A woman's reproductive system includes the vagina, cervix, uterus, fallopian tubes, and ovaries. During the monthly menstrual cycle, one of the ovaries releases an egg in a process called ovulation. After ovulation, the egg enters the fallopian tube. A woman is most likely to become pregnant if she has sex in the days just before, during, or right after ovulation. During this time, a sperm cell from a man's reproductive fluid, called semen, is able to fertilize the egg just inside the fallopian tube. As it travels along the fallopian tube, the fertilized egg, now called an embryo, loses the outer cells that nourished it in the ovary. The embryo passes from the fallopian tube into the uterus. In the uterus, the embryo sheds its protective outer layer, called the zona pellucida, in a process called zona hatching. Zona hatching is necessary for the embryo to implant in the tissue lining the uterus. During implantation, a connection between the woman and the embryo begins to grow. This organ, called the placenta, allows oxygen and nutrients to pass from her to the embryo. In vitro fertilization may be performed if a woman has been having trouble getting pregnant, a condition known as infertility, or it may be done if a woman wants to have a child without a male partner. Before in vitro fertilization, a woman will receive fertility medication that causes more than one egg to grow and mature in the ovaries. A man will provide a semen sample so that the healthiest sperm can be collected for fertilization. If the male partner is completely infertile, also known as sterile, or the woman doesn't have a male partner, a donor may be arranged to provide sperm for this process. In vitro fertilization consists of 3 main procedures: follicle aspiration, fertilization, and embryo transfer. During the first procedure, called follicle aspiration, eggs will be harvested from the ovaries. At the beginning of this procedure, an ultrasound probe will be inserted into the woman's vagina so that her doctor can view her ovaries. Inside the ovaries, the doctor will look for follicles. Each follicle is a fluid-filled sac that contains an egg. Then the doctor will insert a long, thin needle into and through the wall of her vagina and guide it to the ovary. A suction device connected to the needle will collect several eggs from inside their follicles. During the second part of in vitro fertilization, called fertilization, the collected eggs will be taken immediately to a laboratory where they will be fertilized. Fertilization may be performed by insemination, where several sperm are mixed with the healthiest eggs. Or the eggs may be fertilized with sperm injected directly into them during a process called intracytoplasmic sperm injection. The fertilized eggs, also called embryos, will be monitored for 3 to 5 days as they begin to grow. At this time, the lab may create a hole in the zona pellucida surrounding some of the embryos. This process, called assisted hatching, will help these embryos implant in the uterus. Some of the embryos will be used right away for embryo transfer, and the rest will be frozen and stored for future use if necessary. The third part of in vitro fertilization is called embryo transfer, which is done 3 to 5 days after fertilization. During embryo transfer, a tool called a speculum will be inserted into the woman's vagina so that the doctor can see her cervix. A syringe will be loaded with fluid containing one or more of the hatched embryos. Then the syringe will be attached to a long, thin tube called a catheter. The doctor will insert the catheter into the vagina, through the cervix, and into the uterus. Once inside the uterus, the doctor will inject the embryos. Then the catheter and speculum will be removed. The woman may continue to lie on her back for about 15 minutes.
I'm sure the video was quite clear, right? How the IVF is taking place. They take the egg and the sperm from the woman and man, and they do it in the lab. Once it is fertilized outside the lab, once it begins the life, then they implant it in the womb of the woman. Okay, then only the life begins. Life begins already in a research lab, but later they insert it using this IVF method. Now let us see infertility in India. Since why they go for IVF? Because of their infertile, not able to produce by use of a natural way, natural method. That is the reason the couple go to IVF centers, to have an artificial way of having children, not the natural. So let us see, have a quick glance, the infertility rate and what you call situation here in India. India is the second most populous country in the world. You agree with me? After China, India is the most populous country in the world, with a population of over 1.3 billion people. It is second only to China. However, overpopulation is not the only problem that we are facing today in India. There is also another problem that is still not talked about very openly, and that is the growing problem of infertility. People not talk openly about the infertility to the people. According to the report by Indian Society of Assisted Reproduction, 10 to 14% of Indian population suffers from infertility. Couples, they do not have children by natural way in their marriage, within the marriage. According to some estimates, this amounts to roughly 1 in every 6 couple in urban area. So 1 in every 6 couple in urban village area, they suffer infertility. They do not have the children. They are childless, childless couple. Also, another report says in 2015, estimated about 27 million, 1 million is equal to 10 lakhs, 27.5 million couples in India wanted to conceive children, but were unable to do so naturally. Okay, that is the situation here in India. World IVF Day, that is in vitro fertilization, was observed, celebrated on July 25th of every year. Okay, it is celebrated July 25th of every year. Also, it symbolizes the essence and the significance of the in vitro fertilization technique in infertility treatment. In the last 3 months, that is this year, ever since the corona started, here in India, we came to aware, and what you call quarantine, they were taking place from the month of March, end of March. They say that from April to June, that is this year, 2020, less than 1,000 patients sought IVF treatment. There has been a steep fall in the number of patients from 50,000 to 1,000 a quarter, say in a quarter, that is in what you call in 3-4 months, no, say fertility experts, no, usually in 3-4 months there are about 50,000 couples. 50,000 couple, they go to IVF center, no, have the method and what you call get conceived. But due to corona, all are locked down, quarantine, nobody is taking risk, no, to go to hospital and have the IVF treatment because they're afraid, no, afraid of corona and afraid of the baby that they are going to carry. So they avoided going to IVF centers. Nearly how many? If you calculate, then what you call almost 49,000 people. No, the couple, they avoided going to IVF center. There are hundreds of IVF centers here in India, no, and it's very expensive, very expensive. So due to corona and quarantine, many couple avoided going to IVF. The experts say they are about what you call 49,000. Only 1,000 people or 1,000 couple came to IVF during what you call last, what you call from April to April to June. It should have been 50,000 people, women going to IVF center. That is the situation here in India that you are facing. In vitro fertilization brings about new life, surely those couple, those who are disappointed, those who are saddened because of they don't have children in the family, IVF gives a new solution, new hope, a new life, in a petri dish, but it takes place in a petri dish. Children engendered through IVF are sometimes known as test tube babies. Several eggs are aspirated from the woman's ovary after she has taken a fertility drug which causes a number of eggs to mature at the same time. As I said earlier, according to the natural circle or natural cycle, only one egg can produce each month, but due to what you call the drugs that the woman is taking, the number of eggs are being produced at a time forcefully, not by natural, by force. Okay, semen is collected from the man, usually through masturbation. The egg and sperm are ultimately joined in a glass dish, that is called petri dish, where conception takes place and the new life is beginning in a petri glass dish. Okay, and the new life is allowed to develop for several days. In the simplest case, embryos are then transferred to the mother's womb in the hope that one will survive to the following 9 months. Then after implanting in mother's womb, we don't know how many are going to survive, but they are hoping at least one will survive. Now, IVF also is expensive, not so cheap, not very. Costing about $10,000 in United States of America. Depends on the what you call doctor and what you call hospital, and depends on the place. If it is city and capital, sure, it's going to cost about. In India, it could cost some 80,000 to 1,20,000 each time the woman goes to IVF center for treatment and the medicine, everything, doctor's fees, everything. Minimum. Depends on the area. Depends on the hospital. If the hospital is very highly qualified doctors, like we have many hospitals in India, very costly. You go and get the treatment for fever, you take the bill and see, and you also go to another doctor in other places, compare the bills, amount. I told you in our yearly classes, one of our chief minister in India, when she was admitted in the hospital for 3 months, the cost came so much, about crores, and the food alone came about 1.5 crore. Food alone for 1.5 months it came about 1.5 crore. Then they calculated, which means she was almost every day she was eating idli and dosha. So one idli costed about 1 lakh or something. They came, in the media they brought about I shall not say which chief minister, which hospital. That was the amount. I mean, the chief minister is no more. The chief minister is no more, but then when they calculated the amount, they charged for treating, because the hospital was well qualified, very high doctors. I mean, of course, some came from abroad, and the food treatment costed so much. Okay, so they calculated the media and the political parties, which means one idli cost 1.5 lakh. 1.5 lakh. That was the amount they charged when, the chief minister died. When the bill came, when they released the statement about a treatment, chief minister treatment and the bill expense, it came in crores just for 1.5 months. The food alone came so many lakhs per one person. So it depends on the hospital where you go. The treatment also, some hospitals, it could begin starting from 80,000 up to 1.20 lakhs. Depends on the hospital and the area where you are going, depends on the physician. So they also been charged. So over 90% of the embryos are created to perish at some point in the process. All are not given chance. All the sperms and all the eggs are not given chance in IVF. Only they are chosen, what you call being chosen by the physician, the technician, which is highly qualified or which is really good. Others are simply discarded. In a desire to hold down cost, not to go again and again to IVF, patients may seek more embryos to be implanted. Some patients, they think that the more time they go, the more expense. The better at a time you implant in my womb, 2 or 3 embryos. Let us see which one is surviving. In some cases there are twins. I don't say that they went to hospital, but then natural way of also taking place. Some cases the woman is giving birth, 4 or 5, even 8. There are world records. It's there in the record. Women has given birth. Some women have given birth 3, 4, 5 children at a time. Okay, at a time. We shall come to that. Now, patients may seek more embryos to be planted, or in some cases, doctors sometimes implant 5 or more embryos in the mother's womb. This may result in more babies than a couple wants. For example, couple they're desiring for a single child, but when you implant more embryos, there is a possibility of 2 or 3 babies being formed. Okay, there's a possibility. There are cases in the history. Now, in Canada, one woman gave birth to 5 children engendered by IVF. She had wanted only one. So she, sued her doctor for wrongful life, demanding that the doctor, pays to her the cost of raising the 4 other children, which she really did not want. It is taking place. The child, she wanted only one child, one baby. She approached the doctor for the treatment of IVF. The doctor thought, maybe by implanting only one embryo, she may be successful, may not be successful. Maybe I don't know what the doctor thought. So he implanted 4 or 5 embryos in her womb. The result was all the embryos were successful, and she gave birth to 5 children. 5 children. Now the issue is she doesn't want other 4. Now what she's going to do? She filed a case in the court and made the doctor to pay for the bringing up her. Yeah, it is there. You search in the Google and other books, it is there. Not only in Canada, also in America and other countries. The couple may be desiring because they are economically poor. All that they can do is to bring up only one child. Now what about other 4 children? How they are going to bring up? So she filed a case in the court because I went to IVF. I wanted only one child. That was the agreement done. She signed for, but then the result is 4 children extra. It's not just laying eggs and you make omelette and eat other 4. No, it's children. Children. You can't simply throw down or do whatever you want. No. She filed a case against the doctor, and the doctor had to pay. This is another result of IVF. One side, sure, the couple there is a possibility of getting conceived, pregnant. But there is another danger. The danger is the physician decides. He takes whatever he wants. Others, he either frozen them or he just rejects them. There is also danger. The womb, of embryos, many are being formed, not one. So the challenges of IVF. Okay. Now you may ask, what is infertility? Why do a couple have this cause or symptom of infertility? Infertility is not a disease. Okay, we have to be clear. Infertility is not a disease. This is a condition in which a couple is unable to conceive despite having the regular relationship. After marriage or within the marriage, they have their normal relationship, but in spite they are not getting successful. They are unable to conceive. While infertility is assumed to be a female issue in the most cases. In India and other countries, they think that women has got the problem. Men are perfectly all right. No, I'm okay. Only you have the problem. You have to go on, check with your doctor. No, what is your problem? No? Why you are not getting conceived? But it is not so. No, a couple's inability to have children can also come from problems with the male reproductive system. As I said in our earlier classes, no, maybe low count, no, in sperms from the part of man, from the part of husband, or his sperms are not strong enough. No, there is also problem with the man, not only with the women. Okay, don't simply blame the women in the family. Also, we also have to take the responsibility. Okay, now reasons why there is infertility. As I said, infertility is not a disease. Okay, it is not a disease. Now, infertility in men, there are many problems, no, many issues like diabetes. No, those patients who are suffering from diabetes, they are not able to give healthy or proper sperms, in their conjugal act. Also smoking and alcohol. You imagine, take a man who is a regular smoker, chain smoker and regular alcoholist. Then can imagine what sort of the health issues he'll be having, and what sort of sperms he may be producing in the in the relationship. It is also a problem with the men, not only with the women. You keep on smoking, keep on drinking, you are bringing great hazard to your health system. All your organs are affected. Lungs, kidneys, everything is affected because you are chain smoker and you continue to drink. Also overweight, obesity, eating too much. You are fat enough, not too much fat, and overweight. It's also a problem. Yeah, it's also a problem that where your sperms may not be that opt enough, to give life, These are the reasons that a scientist or technician would say. Also stress and lack of sleep. Another reason would be stress, and when you take a lot of stress and depression, in the mind, it is from the mind, it passes all of your body. And when you don't sleep proper sleep, also it affects all of your the body system, not only the reproductive but also mind, heart, everything. Okay, so everything is connected. Everything is connected. And other genetic reasons. Also, infertility in women, because of the age. In India, we think we give them in marriage after 18, very soon. But it is not so in abroad. They live together sometime, they have that relationship, but then they marry officially at the age of 30 or 35, even 40. Even at the age of 40, depends on the cases and So in India, we think that after 18 immediately we should be given in the marriage, because later the more delay, the more problem. That is what many of the parents would think. Also, we have to safeguard the girl, the family. Whenever she goes out, we are afraid whether she will come safe or something is taking place. Parents are sometimes restless, keeping a girl, the family, because what is up. Lot of things are taking place in India. Girls are not safe. Girls are not safe when they go out and when they come alone. So they want to give them in marriage as earliest possible. So before age 35, they should be given marriage and they should have the children. Also unhealthy eating habits. These days, the fast food, oil and sometimes food is frozen. Go to supermarket, there's a deep freezer there. Things are frozen. They are made and kept. Whenever you want, you take them, fry them or cook them and eat. They are not fresh actually. They are not fresh. When today the world is so fast, the couples and the people, they don't have time to cook. They don't have time to wash the dishes. They go for everything fast. Come from the office, buy what is there on the street. We don't know what oil is using and what method is preparing, or buy from supermarket. The frozen ones, be it chips or be it a fish, be it meat, anything frozen. They are not fresh. They are not fresh. They may be cut and kept for 1 month back. 1 month back. That you buy them and ready-made. In 5 minutes you keep them on the fire. The food is ready. Because of the fast food and unhealthy eating. Also time also matters. We have you can't eat lunch at 4 o'clock every day and supper at 12 o'clock and go to sleep at night. We should regulate the food system, very important, not only for the relationship, but also our what you call our day-to-day life and other activities. If you go against the natural circle, go against our food system, which you are supposed to take morning breakfast, 7 to 8 or 9 maximum. If you take beyond that, then it doesn't adjust. You are going to bed 10 o'clock and you're taking breakfast next day 10 o'clock is equal to 12 hours you are without food and water. Food and water. It is against the our health system. So we should take food every time on time. Be it breakfast or noon meals or evening dinner, you have to take everything on time. When you go zigzag, it doesn't help you. It doesn't help your bodily system. It may give some other infection, some other diseases. Also diet. Some people are too much worried about the diet. They avoid vegetables. They avoid non-veg. There are ways to take at least the minimum, whatever you can in a week. Some people are too much. They avoid vegetables, or they take only the veg, or only the non-veg. If you give them lady's finger or for example, I have seen people, seminarians even, you give them bitter gourd, they think, it is a Good Friday. When you give them bitter gourd, they think that it is a Good Friday. Father is asking me, or procurator has given bitter gourd. It is very bitter. No, very bitter. Nobody is not able to keep in mouth, not able to eat, not able to afford, not able to eat bitter gourd, which is very healthier. And fight against the sugar. Fight against the sugar. Diabetes, they eat bitter gourd. It's very healthy food. You eat a lot of sugar, you eat a lot of chocolates, you eat a lot of sweets, and you don't do any exercise, you don't do any games. It is being stored there. It's being stored there. You have to exercise and bring balance whatever you eat. Not that you simply store it inside. So vegetables are always good and they are healthy. Don't go for too much. Only one side, avoiding non-veg, or only taking non-veg, avoiding fully veg. You should keep proportionate. You should keep balance. Okay. And other infections and tuberculosis, etc. These are the symptoms why women are infertile today. Okay.